Looking back on 2021, One Community Health has again accomplished an extraordinary amount. All of this in spite of the pandemic, the Great Resignation, extreme weather, and soaring housing costs. While we had dreams of a post-COVID world by now, our reality is different. That being said, OCH has once again shown the community that we care. Here is the top 10 2021 video as voted on by OCH staff. The shutdown in 2020 resulted in a backlog of preventative care that we are still trying to address. OCH held 3 Well Child Check events in August in both Hood River and the Dalles, during which we saw 113 kids. We designed a back-to-school health fair that made a Well Child Check more comprehensive and fun for kids. OCH also hosted Dia de la Salud in Hood River back in November. OCH combined the event with KCI vision screenings, and the Preventative Health team will be expanding the vision services that we offer to patients through that partnership. The pandemic has brought a number of challenges related to workforce, supply chain, and healthcare access. One Community Health developed closer ties to the region's local employers, community partners, schools, state and federal agencies. One Community Health worked with more than 100 employers and orchards this year. In fact, we held our largest event at Duckwall's cold storage facility near Pine Grove, vaccinating over 600 people. Our amazing recruiting team filled nearly 100 positions in 2021 and grew our organizational FTE to 250. In 2021, 18% of all employees received a promotion, 66% went to BIPOC employees. OCH will usher in a new executive leadership in light of Chief Health Officer Elizabeth Ogney and Chief Financial Officer Belinda Botch's retirements. Our recruiting team is expanding as well to keep up with this tremendous pace. OCH rewarded performance with merit-based salary increases for the first time this past year. Calibration meetings provided a forum for discussing the individual performance of team members, with the goal of making sure that managers apply similar standards across all employees. Through our partnership with the Columbia River Intertribal Fish Commission, OCH was able to purchase and outfit a mobile medical unit this year. Monday, November 22nd marked the first official date where OCH medical encounters were generated through a mobile medical service unit. Registered nurse Rosie Supa and community health worker Iona Frank led OCH's native outreach efforts. And Rosie and Iona visited 12 different in-lieu sites along the river. The patients they saw provided valuable information on the healthcare services needed. The Waikonishpa Mobile Medical Unit will continue to bring care directly to the Native communities and tailor its services and schedule in 2022 to their needs. The Preventative Health team kicked off in-person and virtual exercise classes to staff on March 1st and expanded it to patients later this year. Silvia Maciel, RN and Salud Manager, is an exercise instructor herself and has been very passionate about bringing this to OCH. The team has been regularly providing exercise classes to patients and their families in both Hood River and the Dalles. The phone operators were challenged in 2021 by ever-changing COVID workflows, increased phone volumes, and managerial transitions. This past fall, answer rates and team morale were low, and patient complaints were coming in as a result. Flor Mesa volunteered to serve as interim manager. Flor established workflows, conducted quality reviews of calls to coach the team on identified improvements, and set up regular team meetings and one-on-ones. Answer rates shot up from 60 to 65% to over 90% on both our English and Spanish main operator lines. In September, OCH received a 2021 Top Workplace Award from the Oregonian. It is very impressive to receive this award in the midst of a pandemic and all the challenges that the healthcare industry has faced over the past 2 years. We thank you all for your participation and constructive comments in the survey. The pandemic has exacerbated many of the workforce issues OCH was already grappling with. Talent Acquisition Manager Emily Higgins was able to find a grant-funded partner, and in July, the Human Resources team launched a medical assistant apprenticeship program. Our partner has a 100% certification pass rate and offers apprenticeship candidates the unique opportunity to receive paid-on-the-job training, online instruction, and mentorship. The program allowed OCH to promote 13 medical assistants as mentors and a mix of 19 internal and external candidates joined the first year of training. At the beginning of the year, we were faced with the daunting task of resuming preventative care for our patients while vaccinating as many in the community as possible. The logistics seemed unbelievable at the time, and yet we did it. OCH provided 19,125 vaccines in 2021. How did we do it? The medical assistants deserve a particularly huge shout out as being the ones who largely administered this astounding number of vaccines. The outreach team coordinated off-site events and education and pre-registered farm workers. Our vaccine efforts this year were truly an example of what we all can do together as a team. Thank you all.